A hearty good morning and welcome to the session on urine infection during pregnancy. We are glad to have Dr. Sheetal Sachdev among us today to help us understand the topic. She will take us through that and more in the session today. Doctor, you have the stage.
Thank you. Thanks a lot. And I welcome everyone for joining this session. And today we'll be discussing one of the most common problems we encounter in pregnancy, the urinary tract infections. Now, for first, what's the urinary tract infection? Let's understand it. It's the infection of the urinary tract. That urinary tract involves the infection of the kidney, the ureters, the bladder, and the small pipe in the end, the urethra. Now, females are anyways more predisposed to urinary infection because the urethra is little shorter among the females. And for the pregnant ladies, again, the symptoms are aggravated and they're more predisposed to urinary infection because they are the immunocompromised population. So, because there are certain other factors also in pregnant females, one is that the hormones, the progesterone, is in the higher amount in the body, which leads to vesico-ureteric reflux, due to which we all have a tendency for higher infection rate. Another reason could be the presence of increased levels of glucose and proteins in the urine. That also predisposes the ladies in pregnancy for the urinary infection. The third factor is that in pregnancy, as the uterus grows in size, it presses the bladder. The bladder is present just in front of the uterus, and due to which it is at times unable to empty completely, due to which there is some leftover urine, which could be a possible source of infection for all the pregnant ladies. And another reason could be patients who are suffering from gestational diabetes mellitus. The sugars are higher, so anyways they have a problem with that. Another thing is that sometimes the bacteria from the motions, the poop, they also get a chance to enter the urinary tract. That is more common among females who have a tendency to wipe from back to front. So we ask you to avoid the direction. If you want to wipe after passing motions, then it should be from front to back, not the other way around. Another reason could be the sexual activity during pregnancy. That could also lead to increased infection rate if the partner is infected or the bacteria get an easy access to the urinary tract. Now, in case you have symptoms of urinary infection, do not ignore them. For the simple reason that if somebody has a urinary infection, then it can lead to increased rates of preterm labor and the miscarriages. So, first of all, you see your doctor. Now, the common symptoms which would help you in identifying the presence of the urinary infection could be that there could be a sense of urgency while passing urine. You might not be able to hold your urine once you get the sensation. There would be increased frequency, the increased trips to the washroom. Then you might be having a trouble in passing urine. You might feel that you are not emptying completely. There could be a sense of burning sensation while you pee. Sometimes patients complain of cramp in the lower abdomen, especially in the front, and there could be backache as well. There might be presence of the cloudy urine also that may be foul smelling. That would also raise the red alert and set the alarm bells ringing that you need to see the doctor. If the infection is severe, then the person may have presence of fever or nausea or vomiting, and the backache could be there. At times, if the infection is severe, then there might be presence of blood in the urine. So you might notice a tinge of redness or pinkish color or a cola colored blood. That would indicate an old bleeding somewhere. So definitely you see a doctor. Now, once you approach us with the infection, then what we do, we diagnose. We try to diagnose the problem. We send you a sample for urine routine and urine culture. Now, for the urine routine, what happens is that the advantage is that we get to know the number of pus cells present in the urine at that moment. So, depending on the number of pus cells, it helps us in knowing, guiding us about the severity of the problem. Another thing would be that the presence of red blood cells would indicate the severity of the infection, whether the blood which you noticed was actually from the urine or not. Another thing is that if the infection is severe, if the pus cells are high number, then it helps us in guiding us with regards to the duration of antibiotics which we would like to start. Now, the advantage of urine routine would be that the results are available on the same day. So your doctor would have some idea by the evening whether you need the antibiotics or not, what sort of a treatment we should be looking at, and the duration as well. But unfortunately, it's not going to tell us about the bacteria. And in case we start the antibiotic and that bacteria is not sensitive to that antibiotic, so after 3 days, you might not still, after 48 hours, you might not be getting a relief. So that is the reason we suggest that you should get a urine culture as well. Now, the urine culture, you again give the sample along with the urine routine, and the reports are available after 48 hours of incubation. So it would be available after 48 to 72 hours, depending when you had given the sample, whether in the morning or evening. Now, the advantage of urine culture is that it helps us in identifying the bacteria, although it's not necessary that it will always identify the bacteria, but most likely it will. And it will give us a hint also, an indication also, that which all antibiotics the bacteria is sensitive to and resistant to as well. So, if by the time you receive the urine culture report, we would be knowing, we would be able to assess whether you have had relief with our medications or not, and whether we need to change any antibiotic or any medicine if you haven't had the relief based on the urine culture report. Now, the only thing is that you have to be patient and you have to wait for 2 to 3 days for the report to be available. So, if the symptoms are severe, then we start the antibiotic prophylactically along with the sample once you are given a sample. And in case you are patient and the symptoms are not that severe, then we give you rest of the medications instead of the antibiotic. Now, also, we suggest that you should check your blood sugar levels also. You should get your blood sugar levels checked also so as to identify any undiagnosed case of diabetes or borderline sugars. So, we counsel you accordingly. Now, once we have diagnosed the problem based on your clinical symptoms and the signs and the urine routine report, we advise you certain medication. Now, first advice from our side would always be once you notice the symptoms, start having plain water, start have plenty of fluids, avoid sugary drinks, have plain water. Also, I suggest to my patients that they can start off with citro soda sachets as well. Now, what is it? They are the urine alkalizer. So it alters the pH in a favorable manner. So the bacteria are easily able to flush out from the urinary tract. So many a times you are spared the use of further medication. So citro soda we generally suggest in pregnancy as well. You are supposed to dissolve one sachet in half a glass of water and take it 2 times a day for 5 days under the supervision of your gynecologist. Then we also suggest certain anti-inflammatory medicine, something, some medicines to relax the bladder also, so as to make you more comfortable and decrease the number of trips you have to go for the washroom. Based on the symptoms and the urine routine report, we suggest your antibiotic medication also. That could be given from 5 to 7 days, depending on the severity. Now, this is the basic treatment protocol which we follow. Now, how can you best prevent the occurrence of urinary infection? There are certain general measures which, if you follow, if you exercise, then you are spared the recurrent episodes. First would be the drink plenty of water. Drink at least 8 glasses of water, whether you're pregnant or not. But then again, drinking plain water helps in flushing out the usual bacteria as well. And when you go to the washroom, when you pass motion, then always try to wipe from front to back, not the other way around. Empty your bladder pre and post sex. That always also helps in flushing out the any untoward bacterial infection, which would have a tendency to enter your urinary tract. Avoid using strong deodorants or soaps which can irritate your bladder. So we don't want the bladder to be irritated. So you can only use mild soap and water for perineal care, for perineal hygiene. You don't need to use any strong medication. Use cotton undergarments. Also avoid tight pants because that also helps in aggravating your infection. Try not to hold urine for too long. I know once if you are working, if you are out, we are traveling, we tend to avoid public washrooms and we tend to hold urine. But as a gynecologist, we always suggest that it's always better not to hold the urine for too long a time. Vitamin C supplementation, zinc supplementation helps in improving your immunity. So you take it under the supervision of your doctor. Cranberry juice may help, but we don't. You can use it. You can try it from your end, but per se, it's not a part of the general advice medicines which we give. We suggest vitamin C from our end. Also avoid while you are having the infection, or even if otherwise also avoid alcohol, coffee, or spicy food that can also irritate your bladder. So with these measures, if you exercise these measures, you can avoid the occurrence of frequent urinary tract infection episodes. So these would be, I hope this is helpful for you, and I hope the session would be useful. In case you have any queries, you can post it in the comment section. I'll definitely answer them. And I hope you have a happy pregnancy and you avoid all the infections which come your way, and you have a lot of water. Take care. Bye. So I think we are done. And if there is anything else, you let me know and we can leave now. Thank you. Have a good day.